Hello, in this video we will discuss about the beta blockers. The beta blocker is the drug which that is using for the blocking of the beta receptor and the beta 1 and 2 receptor, remember. So what is the beta blocker? Beta blocker will block the beta receptor and the epinephrine will not bind. Like beta blocker work by blocking the effect of the hormones epinephrine, also known as the adrenaline, because it releases from the adrenal gland or adrenergic nerves. And the beta blockers causes the heart to beat more slowly and with less force, so it in this way that which lowers the blood pressure. And beta blockers also help widen veins, it means the vasodilation, and the arteries to improve the blood flow. So the arteries to improve the blood flow, in this way the decrease of the blood pressure, because the widen of the arteries will lead to increase the low blood pressure. So the low blood pressure will increase, basically decrease the high blood pressure. So anyhow, the beta blockers drug which that will target differently the two type of the targeting on the basis of the beta receptor beta blockers. So the non-cardiac selective binds the beta 1 beta 2 receptor, while the cardio selective binds the largely to beta 1 receptor. So in this way, here you can see the beta blocker. This beta blocker will enter into the blood vessel. After entering into the blood circulatory system, when you will take the beta blocker drug, so after this it will be targeted to the as a antagonistic or agonistic, and it will be bound with the beta 1 receptor or beta 2 receptor, remember. And the cyclic AMP when decrease will lead to effect, and cyclic AMP will lead to effect differently for beta 2 receptor when bind. And this is the competitive binding, the competitive molecule against the epinephrine. So the epinephrine will not bind, if so it will be take the place for binding. So the antagonistic work, this is the antagonistic, mean this is the against the epinephrine. Anyhow, the beta 2 receptor, beta 1 receptor, let's begin to understand the adrenergic nerve, and it will release the epinephrine. So this is the beta blockers bind to beta 1 and beta 2 receptor of various tissue through our body, and thus the competitive inhibitor of sympathetic adrenergic molecule. In this way, the sympathetic nervous system will inhibit, because the epinephrine will not bind with the specific tissue, because the beta blocker is binding here. So the competition will occur. In this way, very difficult to bind, because already the beta blocker will bind with the beta 1 receptor and 2 receptor. So throughout tissue, if we will discuss collectively the beta 2 receptor here, this beta 2 receptor require for the epinephrine the sympathetic nervous system activation, and this will lead to blocking the epinephrine will target and trigger the 3 sodium move inside and 2 potassium will move outside. In this way, decrease the cyclic AMP. And when decrease the cyclic AMP throughout tissues, and in this way the intracellular and extracellular. Intracellular mean within the cell, and the extracellular mean outside of the cell, the potassium will be maintained equal. In this way, this is the intracellular cation, but it is also present in the extracellular same quantity. In this way, when go into the blood vessel, in this way, the potassium increase will lead to hyperkalemia. So here is the beta 2 receptor agonist. Agonist mean like a original ligand. In this way, bind with the eyes will lead to decrease the ciliary epithelium's production of aqueous humor, the fluid that fills the anterior chamber of the eye. So this reduces the intraocular pressure. So that is the function. But in the case of beta 2 blocker, the beta 2 blocker will trigger the decreasing of the cyclic AMP, because the epinephrine will not bind if. So in this is the decrease of the cyclic AMP in the lungs. So remember, decrease of the cyclic AMP will trigger the resting airways muscle tone. So the resting airways muscle tone will increase, will lead to trigger the bronchoconstriction, will trigger the bronchoconstriction, will trigger the resistance to airflow, resistance to airflow, increase the resistance to airflow. So remember, increase the resistance to airflow will lead to sign and symptom wheezing, dyspnea, chest tightness, and in this the complication is the exacerbation of the underlying airway disease. So anyhow, let's begin to understand the further the nervous system. What is the effect of the beta 2 receptor agonist? So this that means the agonist mean basically it is not antagonistic against the ligand like a adrenergic response, the epinephrine and norepinephrine for the fight and for flight response. So agonist will bind, and in this way the epinephrine and norepinephrine will not bind. In this way the response will be decreased. So in this way basically response will be decreased, not because it is agonist, response will be occur but decrease the response. So remember, so after this the decreasing of the response will lead to sign and symptom is the tremor, irritability, and the anxiety will lead to complication cause the hypoglycemia, and the unawareness of the hypoglycemia will lead to also cause the hypotension, because hypoglycemia means decrease of the blood glucose. The meaning of the decrease of the blood glucose mean the hypotension, mean the decrease of the blood pressure. So the decrease of the blood pressure and hypoglycemia, the unawareness will lead to hypotension, and that is basically the major complication. So remember. Anyhow, let's begin to understand the beta 1 receptor antagonisms or agonists. The beta 1 receptor antagonist. What is the working of the beta 1 receptor? It will be target on the kidney and heart rate. So the target on the heart, and the target differently the chronotrophy and the entropy. The chronotropy is the heart rate and the conduction velocity will be changed, and the entropy will be decreased. In this way the contractility of the cardiac muscle, which that will be decreased. So that is why. And on the other hand, here you can see this both effect will lead to decrease the oxygen demand of the myocardial tissue, because the decreasing of the heart rate will not require too much energy. So in this way the aerobic respiration will decrease basically. So the bradycardia will occur. Bradycardia mean the heart will pump very less and dilate more. So the diastole will be increased while the systole will be decreased. In this way the inability to increase the heart rate in response to stress and shock. So in this way, the inability to increase the heart rate and in response to stress and shock. On the other hand, here is entropy, which that will lead to decrease the stroke volume. Stroke volume means the pump of the heart, which that is the stroke volume, will be decreased, and the cardiac output will be decreased. Why? Because the basically the feeling of the heart will be increased more. So the hypotension, the decrease of the blood pressure, the blood pressure is equal to the cardiac output into a systemic vascular resistance. Anyhow, here you can see that beta blockers will decrease when, so the diastolic blood pressure, and thus may decrease the coronary perfusion pressure, so the coronary perfusion pressure will be decreased. So the coronary perfusion pressure is equal to the diastolic blood pressure in aorta, and the LV and the diastolic pressure, the minus the LV and the end diastolic pressure. And in this way, it will be also trigger the beta blockers decrease and diastolic blood pressure. thus may decrease the coronary perfusion pressure. In this way, it will be directly before giving the beta blockers ensure the blood pressure isn't too low. So we can check, and after we can provide the beta blockers because the diastolic blood pressure decrease and thus may decrease the coronary perfusion pressure. Otherwise, the may worsen acute myocardial ischemia. On the other hand, the kidney basically the decrease of the renal release and the renin, sorry, not renal, the renin release decrease lead to creation of the angiotensin 2 decrease, and in this way the aldosterone also decrease. In this way, the reabsorption of the sodium and the water in nephron will be decreased, and when decreased, it will lead to increase the urinary sodium and water loss. And on the other hand, that decrease the total blood volume when decrease the total blood volume, and in this way, the decompensation of the acute heart failure and the dizziness and fatigue will be occur. So that is the beta blockers function. That is the beta blocker function. In this way, the beta receptor antagonist is used for the decrease of the hypertension, and this beta blocker will block the epinephrine binding, will inhibit the sympathetic nervous system to decrease the blood pressure. So thanks for watching. Bye.